Hello, glad you're here again. Welcome to the channel. Today we're going to talk about something very serious and important. The critical colon cancer symptoms you should never ignore. Thanks for being here, and if you're not already subscribed, please subscribe to the channel and like the video. This helps us reach more people who need this vital information. Let's get to today's important content. Colon cancer can be silent, and its symptoms are often confused with other less serious conditions. However, it is very important to be aware of the signs that our body gives us on a daily basis. Some of these symptoms are better known, but others may surprise you. Read on to find out why this disease occurs more among African Americans and is so prevalent in the USA, as well as why Japan has the lowest incidence of this disease. So let's get to it. 1. Blood in the stool. One of the most worrying signs is the presence of blood in the stool. It can vary from bright red to almost black, depending on the location of the tumor in the colon. This symptom is a strong indicator that something is not right in the digestive tract. In a study carried out in Japan, 70% of patients diagnosed with colon cancer reported the presence of blood in their stools, demonstrating the importance of this sign. In addition to the color, the amount of blood can also vary. Small amounts can go unnoticed, while larger amounts are more easily noticed. It is essential to be aware of any changes in the stool and to seek medical help if you experience this symptom, especially if it is associated with other signs such as abdominal pain or weight loss. Early detection is vital for effective treatment and can make all the difference to the prognosis.
Please subscribe and click like. Help our channel bring this information to more people who need it.
2. Changes in bowel habits. Any persistent change in bowel habits, such as diarrhea, constipation, or the feeling that the bowel has not emptied completely, can be an indication of something more serious. Changes in the pattern of bowel movements can be an early sign that there is something obstructing or irritating the colon. These changes may be occasional, but if they persist for more than a few weeks, it's time to pay attention. A recent study by the American Cancer Society revealed that 55% of colon cancer patients experienced significant changes in their bowel habits before diagnosis. Again, if these changes are accompanied by other symptoms, the importance of one is crucial to identifying the cause and starting the appropriate treatment. 3. Persistent abdominal pain. Abdominal pain or discomfort that doesn't go away can be a warning sign. This pain can range from mild cramps to intense pain. Colon cancer can cause a feeling of bloating or constant pain in the abdomen. In some cases, the pain may be intermittent, but as the tumor grows, the pain tends to become more constant and severe. The colon and rectum are made up of cells that divide and reproduce in an orderly and controlled manner. When an alteration occurs, excess tissue can be produced, giving rise to a tumor, which can be benign or malignant. This disorderly growth of cells in the large intestine can compress other healthy organs around it and even spread into the bloodstream, causing persistent abdominal pain. If the abdominal pain is accompanied by other symptoms, such as blood in the stool or weight loss, a visit to the doctor becomes even more urgent. 4. Unexplained weight loss. If you're losing weight for no apparent reason, it's a sign that something might be wrong. Colon cancer can interfere with digestion and the absorption of nutrients, leading to weight loss. This is a symptom that is often ignored until the problem becomes more serious. Unexplained weight loss should always be investigated, especially if it is rapid or accompanied by other symptoms. A study carried out in Japan with 850 participants from the city of Tokyo between 2019 and 2020 found that 45% of colon cancer patients reported significant weight loss before diagnosis. Unexplained weight loss can be a sign of several conditions, including colon cancer, and a medical evaluation is essential to determine the cause. 5. Fatigue and weakness. Feeling tired or weak for no apparent reason can be a sign that the body is fighting something more serious, such as colon cancer. Fatigue can be caused by anemia resulting from internal blood loss or by the presence of the cancer itself. Fatigue related to colon cancer is different from ordinary tiredness. It is a feeling of deep exhaustion that does not improve with rest. In a study carried out in Japan with around 650 people aged between 45 and 65, 50% of colon cancer patients reported severe fatigue before diagnosis. Fatigue, especially when combined with other symptoms, warrants a visit to the doctor. Early detection of colon cancer can significantly improve the chances of successful treatment. 6. Anemia. The blood loss caused by colon cancer can lead to anemia, resulting in paleness, shortness of breath, and extreme tiredness. Anemia occurs when the body doesn't have enough red blood cells to transport oxygen properly. Anemia is often detected in routine blood tests before other symptoms appear. If you experience symptoms of anemia, such as extreme fatigue or shortness of breath, you should see a doctor immediately. Anemia can be a sign of several serious conditions, including colon cancer. 7. Nausea and vomiting. Although these symptoms can be associated with various conditions, when combined with other signs, they can indicate colon cancer. The presence of a tumor in the colon can cause obstructions that lead to nausea and vomiting. Constant nausea and vomiting are signs that something is wrong in the digestive system. The combination of symptoms can provide important clues for an early diagnosis. 8. Back pain. It may sound strange, but some people with colon cancer report back pain. This can happen when the tumor presses on nerves or other organs. Back pain can be an indirect symptom of colon cancer, especially if it is persistent and unexplained. The location and intensity of the pain can vary, but if the back pain persists and has no obvious cause, it is important to investigate. If the back pain is accompanied by other symptoms, such as changes in bowel habits or weight loss, the importance of a medical consultation increases. Early diagnosis is essential for effective treatment. 9. Thin or narrow stools. If you notice that your stools are thinner or narrower than normal, this could be a sign of a colon obstruction. This change in the shape of the stool may indicate the presence of a tumor that is partially blocking the colon. Changes in the shape of the stool are often overlooked, but they can be an early sign of colon cancer. If you notice this change and other symptoms, you should seek medical help immediately. Early identification of any changes is essential for effective diagnosis and treatment. 10. Constant flatulence. Constant flatulence can be a warning sign of colon cancer. Although gas production is a normal part of digestion, the presence of a tumor in the colon can significantly increase the amount of gas produced. This is because the tumor can partially obstruct the colon, causing excessive fermentation of undigested food. Constant and excessive flatulence, especially when accompanied by other symptoms such as abdominal pain, changes in bowel habits, or blood in the stool, should be investigated by a doctor. A study carried out in the United States by the Cleveland Clinic analyzed 1,200 patients with persistent gastrointestinal symptoms and found that 15% of them were diagnosed with colon cancer. Flatulence was one of the symptoms reported. Early diagnosis can significantly improve the prognosis and treatment options for colon cancer. Healthy habits and foods that prevent cancer. To prevent various types of complications, it's important to give up certain unhealthy habits, especially from the age of 50. Alcohol and smoking are old favorites when it comes to unhealthy habits. Smoking can cause numerous diseases and various types of cancer, including bowel cancer. As for alcohol, studies suggest an increased risk when the amount ingested exceeds 30 grams of ethanol per day, about 2 doses of alcohol. Among the recognized mechanisms that explain the association between alcohol and cancer is the fact that ethanol, alcohol, is converted in the body into a substance called acetaldehyde. Both are classified as carcinogenic to humans. In addition, ethanol acts as a solvent, making it easier for other carcinogenic substances to enter cells. It's no news that a healthy diet can help prevent various diseases, including colon cancer. Fresh foods, such as fruits and vegetables, have a protective effect and help prevent tumor initiation and progression. They form a group of foods that contain a variety of phytochemicals. These compounds are not considered nutrients, but substances that have anti-cancer effects. It should be noted that a diet rich in fiber, including cereals and whole grains, also contributes to the prevention of colorectal cancer. For example, apples are an excellent fruit because of their high fiber content. Another ally is green tea, known for its antioxidant properties. The fiber in apples helps maintain regular intestinal transit, which is essential for colon health. Studies show that regular fiber consumption can reduce the risk of colon cancer by up to 20%. Green tea contains catechins, which are powerful antioxidants. Research in Japan has shown that daily consumption of green tea is associated with a lower incidence of colon cancer. The study, which analyzed 50,000 participants, showed that those who consumed green tea regularly were 15% less likely to develop the disease. Maintaining a balanced diet, rich in fiber and antioxidants, is one of the best ways to prevent colon cancer. It is also important to avoid processed foods and red meat, which are associated with a higher risk of the disease. The consumption of processed and ultra-processed meats, such as sausage, bologna, sausage, ham, bacon, turkey breast and salami, and excessive intake of red meat can increase the risk of this type of cancer, according to studies. Another factor that increases this risk is smoking, a common procedure for these foods. The substances present in the smoke from the smoking process and the preservatives, such as nitrites and nitrates, also added during processing can cause the onset of intestinal cancer, colon and rectum. Country with the lowest colon cancer incidence rates. Data from scientific studies is essential for understanding the severity and where the highest incidence of colon cancer occurs, which also helps us to understand a little about why it occurs and how to prevent it. According to the World Health Organization, WHO, Japan has one of the lowest incidence rates of colon cancer, which is attributed to its diet rich in fish and vegetables. On the other hand, the United States has one of the highest rates, largely due to its Western diet rich in fats and red meat. Studies show that the incidence of colon cancer has increased in recent years, especially in Western countries. Between 2010 and 2020, the rate of new colon cancer cases increased by 30% in the United States. This increase is strongly associated with lifestyle and eating habits. Studies also show that, because of these habits, men have a slightly higher incidence of colon cancer compared to women. Studies show that men are approximately 30% more likely to develop the disease. In addition to the gender difference, the incidence of colon cancer also varies between different ethnic groups. In the United States, for example, African Americans have the highest incidence and mortality rates for colon cancer compared to other ethnic groups. A study carried out in Japan showed that individuals of Asian descent have lower incidence rates, possibly due to dietary and lifestyle differences. Understanding these variations is crucial for prevention and early diagnosis. Groups at higher risk should be especially vigilant about symptoms and have regular screening tests. Medical consultation is essential for everyone, especially those in higher risk groups, to ensure early detection and effective treatment. For prevention, it is essential to adopt a healthy lifestyle, including a balanced diet, regular exercise, and avoiding alcohol and tobacco consumption. Screening tests, such as colonoscopy, are also crucial for the early detection and effective treatment of colon cancer. Confusion with other diseases. The symptoms of colon cancer can often be confused with other less serious conditions, such as hemorrhoids or irritable bowel syndrome. Blood in the stool, for example, is a common symptom in both colon cancer and hemorrhoids, which can lead to misdiagnosis or delayed diagnosis. To tell the difference, it's important to look out for other associated signs. While hemorrhoids often cause pain and itching in the anal area, colon cancer can be accompanied by systemic symptoms such as weight loss and fatigue. Distinguishing between these conditions can be difficult without proper medical examinations. If you experience persistent and unexplained symptoms, it is crucial to seek immediate medical help for an accurate diagnosis. That's the end of our video. Thank you for joining us. I hope this information is useful for you and your loved ones. Subscribe to the channel, click like and share this video, as this will help spread this vital message to more people. And don't forget to check out our next video on the nighttime signs of diabetes that shouldn't be ignored. Until next time, take care. Thanks for watching. We love that you're joining us. Subscribe, explore our channel, watch more videos, and embark on your journey to wellness with Health Today.